Let me stop the screen share right quick and get on this Facebook. I had shared it was an article in what is this? Washington Times. Here it is. So some people are upset by this. It's an article in the Washington Times posted. When was this posted? Tuesday. Today. It was posted today. And this is some of the stuff these media websites are posting. So you have, what's the title of this? The title is COVID-19 Turning Out to Be Huge Hoax Perpetuated by Media. Washington Post posted that today. Mind you, President Trump said this a while back. Weird. So let me actually read this off. When the postmortem is done on the media's coverage of COVID-19, and it will be clear that the virus was no Black Plague. It's not even the flu on a bad year. SARS-CoV-2, which causes COVID-19. That's interesting. The SARS-CoV-2, which causes COVID-19. So something else causes the COVID. Has killed 56,749 Americans as of Tuesday. That's not good. But it's not as bad as 2017 and 2018 flu season when 80,000 plus perished. And it's a long cry from what all the experts were warning about just a few weeks ago. First, they predicted 1.7 million Americans dead. Well, that's more of a projection than a prediction, I would say. Then they redid the models. This time, apparently entering a few more facts. It said 100,000 to 240,000 dead. Okay, that's not quite 50,000 people. Now, a major model relied on by the White House Coronavirus Task Force predicts about 70,000 dead by the end of August. Okay, 70,000. Rather no people dead, but 70,000. And for what? And for that, we shut down the U.S. economy. Okay, let's read on. As the coronavirus swept across China, then Europe, then everywhere, the U.S. media breathlessly reported every terrifying number, almost gleefully. The ratings soared, of course, as they scared the hell out of every American, many of whom have stayed home for the last 40 days. At 40 days and 40 nights, emerging only to buy toilet paper and even the clad in masks and tiptoeing in fear. Yes, they are tiptoeing in fear. No, I'm not proud of that. But here are some facts. Okay. What's the read more looking like? Fatality rate. Okay. Let's read this. A recent Stanford University antibody study estimated the fatality rate from the virus is likely 0.1% to 0.2%. The World Health Organization, also known as the WHO, had estimated that the death rate was 20 to 30 times higher and called for isolation policies. On which version do you think the media focused? Okay. In New York City, the U.S. epicenter of the pandemic, the death rate for people 18 to 45 years old is 0.01% or 10 per 100,000 in the population. People age 75 and older, though, have a death rate 80 times that. People age 75 and older, though, have a death rate 80 times that. For children under 18, the rate of death is 0 per 100,000. That's 0. They emphasize that that was 0. Health and age. More than half of the COVID deaths in Europe occurring in long-term care or nursing home facilities. At least 1/5 of the deaths recorded in the U.S. so far have occurred there. Nearly all patients hospitalized for the coronavirus in New York City had underlying health conditions, according to recent studies. Let me take a break for that. So they've been saying a lot of COVID deaths. You know, even if you have other ailments, they're just counting it as a COVID death. Somebody could have had the flu, and then they could have counted it as a COVID death. That's foul. But let me continue. Health records from 5,700 patients hospitalized within the Northwell Health System, which housed the most patients in the country throughout the pandemic, showed that 94% of patients had more than one disease had more than one disease other than COVID-19. According to the Journal of the American Medical Association, Fox News reported. The study found 42% of the patients were overweight and 53% had hypertension, and the others suffered from a variety of ailments, far more widespread. Millions and millions of Americans have already been infected with the virus, even though the U.S. media continues to report the low numbers provided by Johns Hopkins, which says that 998,000 Americans have contracted the virus as of Tuesday. An antibody study was conducted last week in New York City and found that 1 in 5, 21.2% of the residents have already been infected with the coronavirus. There are 8.5 million people in New York City, so that would mean 1.8 million New Yorkers have had the virus. At the time of the study, there were 16,249 deaths in the city attributed to COVID-19, which means the death rate in the city was 0.89% at the time, far lower than reports in the U.S. media. Results of antibody survey last week in Los Angeles found as many as 442,000 Los Angeles County residents might have already been infected with the coronavirus by April, a number far higher than the 8,000 cases confirmed at the time. The survey suggests that the death rate from the virus could be as low as 0.18 of COVID-19 patients, which means the actual death rate in the city is far lower than reported. Wait, how much more do we have to go? Not much. Okay. The Daily Mail reported Monday that coronavirus may kill 70 times fewer patients than official UK death figures studies have shown. Let me repeat that. The Daily Mail reported Monday that coronavirus may kill 70 times fewer patients than official UK death figures suggest, studies have shown. The Mail said a similar fatality rate, 0.19%, was found in a study of residents in Helsinki, Finland. A study, this one by Dr. Justin Silverman, estimates that there were 8.7 million coronavirus infections in the U.S. between March 8 and March 28th. As of April 17th, 10% of Americans have been affected, which is roughly 33 million Americans. The media has been hyping COVID-19 since day one. I repeat. The media has been hyping COVID-19 since day one, alarming Americans to the point where they voluntarily went along with the shutting down of the entire economy, a mistake that will likely reverberate for a decade or more. Even as U.S. states begin to reopen based on the data, which shows a far lower fatality rate than the reported and a much wider spread of the virus, the media continue to report on what they deem frightening numbers over the deadly virus. They aren't, and it isn't. COVID is a bad flu at worst, and the media should be held accountable for telling us otherwise before they do the facts. Okay, Joseph Curl for Washington Times. What do you think about that, bro?
Man, I I think that this whole thing, I mean, I felt like it was a farce. I really did. And I don't know much about viruses, but I was kind of questioning: is the COVID-19 artwork the actual depiction of the virus itself? Um, and and this is just a question to the science public out there.
Hmm.
When you have a multiple strain virus, is it one uh, cohesive viral unit, or are there several components, separate in one area? So for example, if you have a virus from a swine that can be differentiated, a bat that can be differentiated, a monkey, both have different viruses, but they eat on one thing, and so now this thing has the combination of the viruses. Would it be one cohesive unit under the microscope, or would it be the three different viruses just occupying one space? So that's just my question to the general public. And as far as uh, the numbers are concerned, I was talking to my father about this, and he said, "Well, how do you account for the deaths?" And I hypothesized that the city is always on fire. That's why you hear the fire trucks all the time. There's gas lines under everyone's house, water lines under everyone's house. And that's just a room for disaster. Does the city tell you about every fire that takes place? No. Does the city tell you how many people actually die from common colds, flu, pneumonia? Do they publicize this? No. And so the corona thing automatically set up a red flag because I knew that they were promoting a virus. And why would you promote a virus? Because you want people to believe in it so that it has more power. They want people to give their.
You muted, bro.
Now, when we think about this virus, we can think in terms of the flu kills 20,000 to 60,000 people in a year. Um, and a lot of people don't even know that. It's not hidden information, it's just things that we don't think to look up. So if we have 20 to 60,000 people dying of the flu every year, how hard would it be for me to just say they died from the corona? Then we have so many people that die from a common cold, so many people that die from various other diseases every year. So if we just put one disease on that, the numbers on the death toll on that disease will be extremely high. The city, the state, the country needs for you to feel safe so that you promote this country by living in it, so that you remain a patron of the society that you live in, so that it can survive. And it needs for you to feel safe. If it's wanting you to feel, if they're warning you about a virus, either the outbreak is so serious that they cannot contain it, and you would probably see people sick everywhere, dying, like right before your face. Like it would be people just laying out in the street, and they wouldn't even have people to pick them up. If that's when the news would tell you something like that. I don't really know why they're pushing this. I think this was a chess move to see how much power the New World Order has, and we'll just call it that. And when I say the New World Order, I mean the connected government bodies of the world, the 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 Union of the Nations,
Mm.
and they want to put out something and see how many people they could get to go along with it, and they succeeded. So that's what I think about this Corona COVID-19.
Mm. Okay, I could definitely see that.